Thank you very much, Joe, and thanks to all for quite a rich discussion over the last few days. Uh, I'd just like to really highlight a few areas that I thought could be further discussed from issues that have been raised earlier in our discussions, then make a few comments at the end. I think it was Roger Glass and a few others who mentioned cook stoves yesterday, and I just thought this was it's an interesting effort that involves a public-private partnership and the complexities of a public-private partnership that we all should take into account. The Global Alliance for Clean Cook Stoves is a public-private partnership hosted by the UN Foundation, where I'm based, and it really is trying to deal with the idea of the problems of open fires, traditional cook stoves, and fuels. That is quite a pressing health and environmental problem. I remember when I first heard about this several years ago, I thought, oh, what's the big deal? But it really is serious, and I recall a few years ago going to southern Ethiopia with one of the members of our committee who isn't here today, Dr. Tachi Yamada, and we visited a home where they were, it was kind of like a tent, teepee kind of a structure. Middle of the day, it was cool out. They had the fire going, and after a short while, Tachi had to leave because there was so much smoke in this home, and they're living with that 24 hours a day. WHO just came out with indoor air quality guidelines and set some benchmarks on this on the 12th of November. It's actually quite a serious issue to have safe, affordable, and accessible clean cooking solutions. The idea is to dramatically reduce fuel consumption and exposure to harmful cook stove smoke while providing economic opportunities in communities across low and middle income countries. So this Global Alliance for Clean Cook Stoves is having a big Cook Stoves Future Summit tomorrow and Friday in New York City. And I think it's interesting to see who's on the agenda for this. It's got the environment sector, the U.S. Administrator for the Environmental Protection Agency and the Minister of the Environment from Nigeria will be speaking. It's got the development assistance sector, the Administrator of USAID and the DFID UK Parliamentary Undersecretary for International Development will be speaking. Foreign ministries, the Ministers of Foreign Affairs from Norway and Ghana. Energy and minerals from the ministers from Ghana and Bangladesh. There's a senior official from the Ministry of Agriculture in China who's going to be one of the speakers. And the keynote speaker is former U.S. Secretary of State Hillary Clinton. So we talked a bit about this with Scott Ratson's discussion yesterday of road safety, but which ministry is engaged? And if you're dealing with this issue of cook stoves, it's not just a health issue, it's not just an energy issue, it's not just an environmental issue, but it's all of them. And that makes it more difficult, but to implement, because who's got the responsibility in country where you're trying to make the difference. But what they've been pushing through this Global Alliance and this public-private partnership is to have all these ministries become engaged, and they're really pushing a private sector model to try to come up with more efficient cook stoves that will be available for sale in the private sector, that it will in the end make a big difference. And our goal is 100 million households will no longer be using these harmful cook stoves by the year 2020. They've got on their website, they've got what they call a community of over 1,000 partners on this, a lot of NGOs, private sector, et cetera. So one of the lessons I think we need to keep in mind in terms of our public-private partnerships efforts is which ministries are involved, and at times it's many ministries, and we have to really be very cognizant of that. On Ebola, I did think it'd be worth mentioning that the UN Foundation and the Global Compact will be working with the UN Mission for Emergency Ebola Response, UNMIR, for a UN business collaboration on the global Ebola response. There will be a meeting on the 11th of December at the United Nations. And they'll be focusing on existing partnerships between business and the United Nations on Ebola, as well as future partnerships. and I said the Global Compact, and this is something where I think it's useful for us to be aware of. This is an initiative of the Secretary General of the UN. It's a strategic policy initiative for businesses that are committed to aligning their operations and strategies with 10 universally accepted principles. And those are principles in the areas of human rights, labor, environment, and anti-corruption, based on various UN documents, including the Universal Declaration of Human Rights. And this is something that we mentioned briefly yesterday, and that we just heard Sir George Allen talk about in terms of some of the difficulties that international organizations have engaging with the private sector. I've been asked to look at this from that multilateral perspective, and there are many ways that the UN is able to partner with the private sector, but there are these issues that then arise, and that's why there is this global compact with the 10 principles that involve, as I said, human rights, labor, environment, and anti-corruption issues, so that you don't have those kinds of controversies. One of the issues we did discuss briefly in this regard was, that I had mentioned yesterday, was WHO's engagement with non-state actors. And given the centrality of the World Health Organization to our work on global public health, I think it's really important that we be aware of some of those specific concerns and specific issues. It's part of the WHO governance reform effort. They're revising their policies on engagement with non-state actors, and that includes NGOs, private sector, profit-making entities, philanthropic foundations, and academic institutions. The draft framework that was discussed in May of this year at the World Health Assembly ended up not being approved, but it had 5 overarching principles, and it's likely that these will be in the final document. Any engagement that WHO has in public-private partnerships and with what they call non-state actors should, number one, demonstrate a clear benefit to public health. Number 2, respect the intergovernmental nature of WHO. Number 3, support and enhance the scientific and evidence-based approach that underpins WHO's work. Number 4, be actively managed so as to reduce and mitigate any form of risk to WHO, including conflicts of interest. And number 5, be conducted on the basis of transparency, openness, inclusiveness, accountability, integrity, and mutual respect. Sounds pretty acceptable to me, but there were some issues that couldn't be resolved among the member states back in May. They did have some boundaries here, and this is something that I think we need to keep in mind as we talk about public-private partnerships in this international field. One of them was an obvious one. Decision-making by the governing bodies of WHO is the exclusive prerogative of the member states. Number 2, WHO's processes in setting norms and standards, and that's a key function of WHO, must be protected from any undue influence. And given the pre-qualification they do for some medications and things such as this, there are very important issues there that they need to maintain the integrity of. Number 3, WHO does not engage with industries making products that directly harm human health. And the specific ones that they single out are the tobacco industry and arms industries. And then finally, engagement with non-state actors must not compromise WHO's integrity, independence, credibility, and reputation. So this framework had been discussed in the executive board meeting in January, and then it was, as a result of that, it was fleshed out and became a much more robust document, but it still was not accepted in the discussions in May. It's under discussion now. Member states are putting in their comments. I know that Sir George Allen suggested that we could try to help the international organizations in this. I'm not sure what role we can do. It's worth considering. I noticed that on the member comments that are on the WHO website in this regard, Bolivia has said that secondments funded by philanthropic organizations have implicit potential risks for WHO's integrity. There are some countries that just are very concerned about this. Now, I have to say, as a former employee of the Bill and Melinda Gates Foundation, sometimes one thinks of the Gates Foundation as the 800-pound gorilla or the elephant in the room, or however you want to phrase it, because there's it gives a lot of money to WHO for specific programs, and the biggest one being the Global Polio Eradication Initiative. But it's far beyond that, and this isn't really focused on the Gates Foundation. It's really a broader-based look that they're still formulating, and I think everyone hopes that they'll be able to come to an agreement this May. One other issue I think that we really need to discuss, and we didn't discuss in any great detail, but that we could consider for future efforts of this forum, would focus on the Sustainable Development Goals. This is probably the biggest thing from a global perspective that's being formulated. There are now draft goals, including one specifically on health, and within that targets that include things like universal health coverage. From my perspective, universal health coverage does very much deal with that equity agenda that we were talking about. There are ways in which we could I would think, try to figure out the role of public-private partnerships in advancing these goals and implementing them once they're agreed upon, which should be next fall by the United Nations General Assembly. In conclusion, I was in Mexico for a meeting of the Global Partnership for Economic Development Cooperation back in April, and Raj Shah, the USAID administrator, told the audience there that he thought that public-private partnerships were the wave of the future, that it would become bigger and bigger. And I think there's a lot to that, and I think the Institute of Medicine deserves great credit for having focused on this by creating this forum. My only point in what I've been saying here is that we really need to keep in mind that global environment, because there are sometimes limits in which a public-private partnership that may seem perfectly fine in the context of the United States and our close working with the private sector and others may not play so well in the global scheme of things. There are these issues that can arise, whether it's in the UN context or the WHO context or others. And as long as we keep that in mind, I think we can certainly have great success and really help foster these public-private partnerships to make a really big difference in global health. Thank you.
Very timely to move on to the U.S. government. Wendy?
So in a